Thanks for being with us today and enjoying the great content put together by Trio Maryland. We want to continue to recognize our event sponsors. So now for a word from Peak Relief.
Welcome to an introduction of the role of medical cannabis with transplantation, a video presentation by Peak Relief, a medical cannabis dispensary in Rockville, Maryland. If you have questions following this video, please feel free to email us info@peakrelief.com. Here are a few key things to remember when utilizing medical cannabis to provide therapeutic relief for issues that you may be facing. One of the most important things to keep in mind is take your time and ask plenty of questions when meeting the staff of a medical cannabis dispensary. If you're able to meet with the dispensary's clinical director, definitely make that a priority. Curious about the endocannabinoid system you keep hearing about? Well, the endocannabinoid system is a complex cell signaling system identified in the early 1900s. The ECS is tied to many of the processes in the human body, some of which you may be pretty familiar with. As you can see, the endocannabinoid system is the key to so many functions and operations in our body. There are many opinions about medical cannabis use, and that's why before adding it to your wellness plan, it's important to speak with your healthcare provider. And if you need more information that may help you speak to your provider, let us know. We will be happy to share educational resources that may help you. Are there complications related to cannabis use for transplant patients? A small number of retrospective studies have assessed transplant outcomes in patients with active cannabis use. In summary, more data are needed to accurately evaluate the association between cannabis use and post-transplant outcome. However, based on small retrospective studies, there is no obvious signal for harm in transplant recipients. Where can I get more information about cannabis use? At Peak Relief, we strive to increase the knowledge of the general public through detailed and informative content that helps to remove the unnecessary stigma surrounding the medical cannabis industry. So head to our website and take advantage of our cannabis curriculum and additional educational resources. It details everything from the parts of the cannabis plant, to the current laws governing the use of medical cannabis in Maryland, to the endocannabinoid system and even the most common routes of administration of medical cannabis. We look forward to your visit if you decide to become a medical cannabis patient. Don't hesitate to send any questions you may have our way.
Thank you so much to Peak Relief. And we want to start our last session of the day, which is mental health, dealing with stress post-transplant. Please remember to post your questions for our speaker, Allison Dietz, in the Q&A tab, and we'll share with her as soon as her presentation is over. We're excited to have Allison with us. She's a social worker in the Department of Psychiatry at the University of Maryland, Baltimore School of Medicine. Allison's particular interests are in the areas of chronic, complex trauma, self-care, and removing barriers to accessing needed supports. Please welcome Allison.
Thank you so much, Michelle, and thank you everybody in attendance. Thank you also to Trio for sponsoring this incredible conference on something that is just so important. Mental health is one of the few content areas or subject areas that just truly cuts across all sectors of life. So very glad to be here with all of you, and hopefully my nerves will begin to die down as we begin the presentation. All right, so I'm just going to share my screen here. All right, excellent. So as Michelle noted, my name is Allison Dietz, and I am a social worker at the University of Maryland. So our agenda today is we're going to start off with a few slides on a feelings wheel. Then we're going to get into some specific examples of cognitive distortions, and we will begin by defining what a cognitive distortion is. We'll go through a mindfulness exercise, and then we will get to the Q&A. So just as a quick disclaimer, everything discussed here is, by and large, speaking generally. It may not apply to you exactly in the way presented or at all. I also want to emphasize that you all are the experts on what it is like to cope with the multitude of stressors following a transplant. I'm just here to summarize some information that I thought might be relevant. So you've likely heard at least some of this stuff before, but even if that's the case, it's my goal that we can all walk away with something new to think about. And then, of course, there also is a handout packet. The table of contents is copied and pasted here. just to kind of outline what is included in there. And I will be making reference to some of those pages as we go along. So there are a lot of feelings wheels out there, but I would bet that no single wheel claims to encompass all possible human emotions. However, I selected this one because I appreciate how it demonstrates the relationships of nuanced emotions, like everything that's out here and in here, to some kind of 6 more core or basic ones. So the takeaways here are that firstly, we have feelings, like a lot of feelings. And sometimes we may feel many of them at once, even if they seem to contradict each other. And the second takeaway is that we as human beings contain multitudes. I selected this Rumi quote, "You are not a drop in the ocean, you are in the entire ocean in a drop," because I think it really captures that complexity. So in social psychology, researchers have categorized emotions using 2 axes. First, as you can see on the horizontal axis there, whether the emotion is essentially positive or essentially negative. And then the vertical axis is whether that person feels better able or more motivated to approach others or to withdraw from others or avoid others. So looking at these 6 core or basic emotions represented in the wheel, and I should also note too that these are not necessarily to scale. I just placed them in the general quadrants where they belong according to research. So we can see how positive emotions like powerful, happy, peaceful tend to also be ones that motivate us to approach or share with others. Negative emotions like fear and sadness are ones that tend to motivate us to withdraw into ourselves. Notably, however, anger is the only negative emotion represented here where we might be more inclined to approach rather than avoid others. So this is definitely apparent in the fight or flight response. So we can see both sides of that. And I once heard a proverb that sorrows shared are divided, joys shared are multiplied. So we can definitely see this in our positive or approach-oriented emotions, but when we're feeling sad, scared, or angry, it can become more difficult to express ourselves constructively to people who can help. So going through the entire process of organ transplantation, from diagnosis to assessments to wait lists to surgery to post-surgical care, and I'm sure that there are many steps that I completely left out of that. That is a grueling process in so many ways, and on caregivers as well as patients. So states of sustained or chronic stress can interfere with our sleep, which in turn can also very strongly influence emotional regulation. And this is one of the ways that our thoughts may also become distorted. So firstly, what is a cognitive distortion? Might be easiest to start with simply defining what a distortion is. So that is just something that is warped, bent, twisted, or otherwise not in its original form. So our perceptions are always filtered through the lenses of our experience, sociodemographics, core beliefs. And basically, it's possible for anyone to have a cognitive distortion or to struggle with a chronically distorted thought pattern. Dr. David Burns, on whose work a lot of today's presentation is based, describes a cognitive distortion as radiostatic, and we will talk about different strategies we can use to retune ourselves so that we're playing music again. And in this hypothetical scenario, there's no such thing as tone deafness. Okay. So in other words, we will be talking about changing perspective, not circumstances. And sometimes this is a necessary first step to make sure that we have, to the best of our abilities, identified what in our environments or what in our environment is under our control. So you will also see how cognitive distortions and strategies to counter them can overlap. But ultimately, the most important thing is that you are able to get an approximation of what is happening in your headspace and then apply something that works for you. So all of the cognitive distortions presented here can certainly have more than 3 identified strategies. To counter them, I just picked 3 for each distortion that we'll talk about a little bit in context. So some basic strategies or some of the sort of, I guess, base strategies for countering cognitive distortions are defined on page 5 of the handout packet. So the first strategy, or the first key strategy that's described, is empathy. And this is also mainly receiving empathy. So it talks about how when we're upset, it may be most helpful sometimes to have someone who is willing to listen to us and truly hear us, and not necessarily try to cheer us up, try to fix something. Sometimes we just need to be heard. And also, too, sometimes it helps to let the other person know at the very beginning that that's what you're looking for. In agenda setting, first, we're trying to define the problem that we want help with. So it must be as real and as specific as possible: person, place, time. And our mindfulness activity later will also help a little bit with this. And then the second, and in my opinion, probably one of the most important aspects of this agenda setting strategy, is after you have defined the problem in terms that are as specific as you could possibly make them, then ask yourself, what would it be worth to me to solve this problem? And how hard would I be willing to work on the solution? So in other words, do you want to get better? And lastly, another key strategy is to identify the distortions using the checklist of cognitive distortions. And on pages 3 and 4 of the handout packet, as well as on page 7, there is a checklist of cognitive distortions on pages 3 and 4, and then there is an additional link to another one online to the Daily Mood Journal template from Dr. David Burns's website, and the link to that online template is provided on page 7. So first we have emotional reasoning. So you take your emotions as evidence for the truth. So if things feel negative, you might assume that they are, and you don't necessarily challenge the validity or the truthfulness of those feelings. So some examples of emotional reasoning might be, I feel unworthy of life when so many people have died or are suffering. And then that becomes, I am unworthy. Or I feel stuck in this rut no matter what I do, becomes, there's nothing I can do. So to counter when we find ourselves in a state of emotional reasoning, and again, there's more than 3. I just picked 3, but the first possible strategy you might use is to examine the evidence. So instead of assuming that your negative thought is true, examine the evidence for it. So asking ourselves, what are the facts? What are the facts saying? So while feelings are social facts, as is noted in qualitative research, and while feelings are also essential to the human experience, they do not necessarily or always equal truth in the situation. Just as an example, I know as I'm currently in school, it is always important to cite many sources whenever possible, and many relevant sources. So next, we have the experimental technique, which again is essentially what it sounds like. So doing an experiment to test the validity or the accuracy or truthfulness rather of a negative thought in much the same way a scientist would test a theory. So asking ourselves, how could I test this to find out if it's really true? So you can also try to counteract a negative state this way. For example, smiling can lead to triggering neurotransmitters that lift our spirits because our brains have an ingrained association between smiling and feeling happy. So laughter is also great here. Can't even tell you how many times I've returned to some of the same YouTube videos over and over again because of their power to just make me laugh no matter how bad I'm feeling. And then also self-monitoring. So that's where we're keeping track of repetitious negative thoughts or anxiety-producing fantasies by counting them. So if you find yourself kind of naturally counting things, or again, this is just about finding a strategy that works for you, that appeals to you, that kind of fits with who you are as a person and where you would like to go. And recording the total number of negative thoughts each day on your calendar. And sometimes just allowing us to call attention to something, to point it out to ourselves, to quantify it, can occasionally just lead to that thought diminishing. And you can even make note of when you see those numbers begin to decrease. So again, the daily mood journal that I mentioned, where the link is on page 7 of the handout, is another great tool for this purpose. So should statements, very emotionally tumultuous. So those can arise from extreme expectations and unhealthy societal norms. The ultimate result is a lot of pressure. So we could have extreme expectations of ourselves, of others, of the world in general, but ultimately the pressure is still something that you feel. For example, if somebody ever says to you that you should be grateful. So if you have any struggles at all that you name out loud, then you're ungrateful when you get that kind of response. Or if you think to yourself, I should be happy, I should be functioning better than this, I shouldn't complain because so many people have it worse. So to counter the semantic method, which essentially is really just referring to the semantics or the meanings of the words. So we're looking for language that is less colorful, less kind of emotionally weighty. So should is often synonymous, at least in my mind, with shame. So try shifting to, for example, it would be good for me to. I know it's more words and it sounds a little bit clunky, but I know, at least for me, when I first started applying this particular shift in language for myself, it really did make a difference. And it's also important too, if you ever find yourself thinking something like, I should be happy, or I should be functioning better than this, or I shouldn't complain because so many people have it worse. Just remember, don't compare traumas. A certain amount of reality checking is always good, but just because something happens to a lot of people, or just because something happens to more people than just you, doesn't mean that your experience with that trauma hasn't affected you. Recently, I heard somebody describe this as same ocean, different boats, which I really liked. Negative practice or worry breaks. And this is kind of right in line with someone like myself who is extraordinarily scheduled. And that is just essentially where we schedule time to intentionally worry or criticize ourselves, which sounds like a little bit of a paradox. So at those times, you can be as self-critical as you want, and then you can use the rest of your time on things that are more productive for you, emotionally and physically. So if you feel strange scheduling time like this, try setting a timer for 5, 10, 15 minutes, maybe once or twice a day. And I will say that there is something about having a timer that you can see literally in front of you that can really just help you to kind of focus on doing something. And essentially what this is doing is it is allowing you to maybe do something that you are doing unintentionally. This time you're doing it intentionally. And you know that, okay, I don't have to think about that right now, or I don't have to think like that right now because I have time for that later. Also, shame attacking exercises So I don't think I aligned this selection well with this particular distortion. This was a mistake that I realized after submitting my slides. But essentially, the shame attacking exercise, as it's defined originally, is where you intentionally do something foolish in public so you can get over a particular fear. So it certainly fits with things around social anxieties or around things like appearing like you have failed at something or that you are not competent at something. So when you can make a fool of yourself on purpose, you discover that the world doesn't come to an end after all. No matter how many times I do things like this for myself, sometimes without even trying, and the world doesn't end, I'm still surprised, quite frankly. But implementing this strategy as written in this context would almost be a little bit closer to the survey technique, which is another cognitive distortion countering strategy. And let's see. Oh, thank you, Michelle. Sorry, I saw the chat notification pop up there. I just wanted to make sure I didn't miss anything. But Michelle, thank you for providing the link to the handout packet. So the survey technique is essentially instructing us to conduct a survey, again, what it sounds like, to find out if your thoughts are realistic. So you can ask yourself, maybe how do other people think and feel about this? Could I ask some friends and get some feedback? And there was an individual I worked with in the past who would sometimes say something out loud, and she would suddenly realize that whatever she said was not necessarily a commonly held belief. And she would look around and say, "Is that wrong?" And it's not that it was wrong, but she didn't realize that she was holding herself to a very unrealistic expectation until she suddenly said it out loud and realized how much pressure she had been putting on herself for so long. So next, we have the mental filter. So this is where you pick out a single negative detail and dwell on it exclusively until all of a sudden that's all you can focus on from the whole situation. So there is a psychological evolutionary reason for this. For example, it takes 9 positive comments to outweigh the impact of 1 negative comment. This particular distortion is based on our survival instinct to focus on the negative because a negative thing might threaten our survival. But it stops serving us when we focus exclusively on the negative. Such as maybe one aspect of a health change that you didn't feel you did well. For example, I'm terrible at remembering to take all of these medications at the right times. So to counter, again, we have self-monitoring. So that's keeping track of just the number of times that we have this particular negative thought throughout the day. Another strategy is to think in shades of gray. So once again, what it sounds like. But when things maybe don't work out as well as you've hoped, if you think it would have been good for me to have done something different in this situation, then all of a sudden that is no longer a shameful thing that you're putting on yourself. That is something that, okay, looking back, I realize now that maybe if I timed things like this, or if I used Post-it reminders for myself in this way, or if I set alarms on my phone, something to that effect. But essentially you can think of things as a partial success, as a learning opportunity. And it's also too, this is, I think, very important to allow us to engage in problem solving, because sometimes if we feel overwhelmed by things we feel that we failed at, again, that overwhelming sensation can really discourage us from doing something constructive in the moment. And then the straightforward technique. And this is just where we're trying to substitute a more positive and realistic thought for each negative thought. So asking ourselves when it comes to the negative thought, do you really believe it? Or is there another way to look at the situation? So I think self-compassion is really important here. There's also in the substance use recovery space, there is a model or a particular program called Celebrate Recovery. And what I most appreciate about the celebrate recovery approach is that the focus is on celebrating the things done well, instead of I had X number of days, months, week, years of clean time in a row, and then one lapse completely erased that. The celebrate recovery approach says that nothing good we've ever done, no success we've ever had is ever erased or canceled out by being human and having some kind of lapse. So again, this ties in nicely with disqualifying the positive. So this isn't where we don't just ignore the positive or those even just emotionally neutral experiences, but actively and unconsciously often transform them into negative ones. So, for example, if your doctor tells you, or if a caregiver praises you for doing such a good job, for remaining compliant with all medications, or adherent with all medications, I should say, and you might tell yourself, well, anyone could do that. To counter this, again, we have self-monitoring. And I noted a particular point over here on the slide where, this can be seen as overly humble. But my one response to that is that remember that humility is not thinking less of yourself. It's simply thinking of yourself less. That was C.S. Lewis, by the way. I don't know the exact reference, but don't want to take credit for that quote. Next, we have the acceptance paradox. So instead of defending ourselves against these self-criticisms, we can find a little bit of truth in them and simply state our own shortcomings and accept them with tranquility. It's how it is phrased in the handout. And even if we don't feel particularly tranquil, I do think that there is something about the calm acceptance of something, of acknowledging where we believe we have fallen short. Because again, we are human, we contain multitudes, and oftentimes there is just no way to ever fully satisfy our own expectations of ourselves in all situations. So here we can tell ourselves, it's true that I have many inadequacies, many shortcomings. I have room for improvement. So in the example that we just used, where you say, well, anybody could do that in terms of doing something well when it comes to your post-surgical recovery, sure, maybe anyone could do that in terms of remaining adherent to your particular medical recovery regimen, but not everyone does. And to persist in doing something that you need to do because you want a better life is worth acknowledging. So it is possible for you to do and have good things. And then paradoxical magnification. So here's another one, kind of like the negative practice or worry breaks. A little bit paradoxical. So instead of trying to refute negative thoughts, you can buy into them, exaggerate them. So it's kind of going one step beyond the acceptance paradox, and just try to make them as extreme as possible until it almost borders on absurdity. So for example, if you feel less than, you could say, yes, it's true. I am probably the most inferior person in this city or this state at this time. And in a way, it's almost kind of making ourselves our own insult comic in a way. Of course, if we're really upset, this is not necessarily the strategy to use, but it is perhaps a way for us to take what we're saying about ourselves and just blow it a little bit out of proportion so that it does become humorous, and that can perhaps help lessen that particular cognitive distortion's power over us. So because we just talked about disqualifying the positive, our example for magnification / minimization, which is where we tend to exaggerate the importance of certain things, most often things we have made mistakes about, or others' achievements, and otherwise inappropriately diminish the importance of things such as what we have done well, and maybe others' imperfections. So, for example, if you return to work and find yourself feeling overwhelmed, tired, or ill, you might think about everything that you still have to do that day, or how you've used up all of your sick leave and can't take any more days off, and tell yourself how overwhelmed you will continue to be as you readjust to your workplace. So to counter this, so we have the double standard technique, where instead of putting ourselves down, we can talk to ourselves in the same compassionate way that we might talk to a good friend who's upset. The most important thing I think to ask ourselves as part of the double standard technique is, would I say such harsh things to a friend with a similar problem? And then if not, why? So you may have heard it said that if we spoke to our friends the way that we speak to ourselves, that we wouldn't have any friends. Remember too how you view your friends. Hopefully trustworthy human beings whose fallibilities or circumstances don't cancel out their worthiness of love and kindness. And then paradoxical magnification again. So again, of course, if we're feeling really upset about this, paradoxical magnification may not work quite as well. But there are plenty of other methods to try if you find yourself in this particular state. And then lastly, being specific. So this is sticking with reality and avoiding judgments about it. So state the facts without adjectives. So instead of I've been out of work for so long, can become I've been out of work for 3 weeks. It is a statement of fact. There's no particular judgment in any of the words used. And I just have to think of it or frame it for myself as describing things without any adjectives, which as a former English major is very hard to do. But if you can do it, I feel like this will be a very good strategy for you to use. So all or nothing thinking. This is where we are evaluating things in extremes and then forcing our experiences or outcomes into just very unforgiving categories. And oftentimes this can set us up for disappointment, whether that is in ourselves or in others. And it can also set us up for things like anxiety, being fearful of mistakes, and also to just anger and resentment and bitterness. And so similar to emotional reasoning in terms of outcome, here all or nothing thinking, there's usually, not always, but usually an inciting event or experience, whether real or possible, as in possible in the future. So this is where we have those absolute words like always or never. For example, whenever I start to have a good day where I feel better, something always happens to ruin it for me, or I always do something to mess it up. So to counter here, first we have reattribution. So this is instead of blaming ourselves entirely for a situation, we can think about the many factors that contributed to it. So asking ourselves, what caused this problem? What did I contribute? What did others contribute? What were the things that were part of this that nobody had any control over? And then lastly, what can I learn from the situation? So just like with the be specific strategy, remove adjectives, stick to facts. When looking at problem origin, don't trace it all the way back to birth or necessarily even to your diagnosis. Just using our example of whenever I start to have a good day, just go back to the beginning of that day at most. We also have the individual downward arrow. So this also refers to the daily mood log. Again, link to that is in on page 7. So this is drawing a downward arrow under the negative thought in our daily mood log, or however you would choose to keep track of these things if you would like to, and asking ourselves, why would it be upsetting to me if this thought were true? What would it mean to me? What would it mean for me? Perhaps a new negative thought comes to mind. Then we can write that down underneath the arrow, draw another arrow, and just kind of lather, rinse, repeat a few times. So when you review that chain of negative thoughts, you can perhaps pinpoint some attitudes, some beliefs that can allow us to be more vulnerable to symptoms of depression or anxiety. So using our example again of whenever I start to have a good day, something always happens. The next progression along that arrow might be, my good days never stay good. And then perhaps the next would be, I will never have a truly good day. And then we can move on to the next strategy, which is thinking in shades of gray. So here, never say never is absolutely your friend. So when you find yourself thinking in terms of always or never, find just one exception, kind of like the experimental technique. So finding just one exception, but don't discount it immediately. Just write it down. So extending our example about the individual downward arrow, I will never have a truly good day can become, I can have days that have good stuff and stressful stuff. Group trauma therapy has a technique, and particularly, I believe it was trauma-focused cognitive behavioral therapy that was administered as part of a group in another country. As one kind of processing activity that they did, they took a bit of string and they laid it down in front of one person who had volunteered to go. And the string essentially represented that own person's timeline. So from birth or wherever they would have preferred to start to where they are today. And then they would lay out flowers representing the good stuff, the things they were happy about, the things they were proud of, along one side as those things occurred chronologically. And then along the other side, they would lay out rocks or something just representing the bad stuff, the trauma, along the other side also chronologically. And at the end of that particular exercise, they would then talk about how they realized that even after traumatic events, that it was still possible for good things to happen. And just like us as human beings, we contain multitudes, so do our lives. So for overgeneralization, this is where we draw conclusions from one or only a few data points, or one or maybe only a few experiences. So one negative experience can kind of set the expectation that it will occur again and again. So like I mentioned at the very beginning, you will see how cognitive distortions overlap and how some of the techniques used to counter them overlap. So here, with the always and the never, we do see elements of the all or nothing thinking. And this is kind of taking all or nothing thinking one step further and applying it to future expectations for things. So for example, you attend physical therapy as part of your post-transplant recovery, and it hurts no matter how much you practice at home. And you have a never-ending association or expectation of experiencing pain that has anything to do with physical therapy. So you might even stop going if you truly believe that it will never get better. So we have examining the evidence. So just remember, it's important for anything to cite multiple sources whenever possible, multiple credible sources whenever possible, which again ties in well with the experimental technique. So we're testing it, right? We're keeping track of things. You can log in your personal pain scores before, during, after PT sessions over time. And then the Socratic method, which is essentially asking yourself questions that will lead to the inconsistencies in our negative thoughts. So in this example that we have with attending physical therapy, we might ask ourselves, at some point, if I do this consistently, have a trusting relationship with my physical therapist, practice at home, and so on, I will have to get stronger. If I get stronger, maybe it won't hurt as much. And then you can apply the experimental technique, examining the evidence along the way, and ultimately begin to kind of lessen the impact that this particular never-ending negative thought prediction had on how we're feeling about doing things that we know in the end are supposed to be good for us. So jumping to conclusions, this is essentially a negative interpretation, whether that's about what others are thinking, mind reading, or when we have a negative interpretation of what may happen in the future, fortune telling, even when there are not necessarily any concrete facts to support our interpretation or prediction of things. So for example, mind reading, thinking that the organ donor or their family would have wanted this organ to go to a good person, and I'm not a good person. Or fortune telling, writing a thank you letter to my donor's family will just remind them of who they've lost. It wouldn't even help me anyway. So to counter, we have the what if technique. So this is an extension of the individual downward arrow. So you'll generate additional thoughts, because remember, we start with the first thought, think about what it would mean to us if this were really true. Another negative thought occurs and we write it down. So you'll generate additional thoughts, and eventually you may find yourself arriving at the thing that you fear the most, perhaps, or the thing that is the most emotionally weighted for you. And then you can ask yourself, how likely is it that this would happen? And could I live with it if it did? We also have self-disclosure. So this is, again, when we looked at those axes before and we saw fear and sadness on the negative side of the horizontal axis, and then also having both of those emotions lead us to be more motivated to withdraw from others rather than approach others. So instead of just kind of continuing to hide those thoughts or feelings, you can disclose them openly. And if you don't yet feel comfortable disclosing this to another person, quite frankly, you can, if you have pets in the home, they can be your audience. Sometimes even just saying something out loud to yourself can do a lot. I know for me, it's always most helpful when I can have things on paper, because it kind of gets those words out of my working memory and I feel unburdened. So using the outreach to organ donors' families as an example, we can practice writing a thank you letter or just a letter. Practice in meaning you don't have to send it. So if you feel like you're letting them down by having bad days, by not being perfect or not being a good person, quote unquote, write that. You don't have to practice writing a list of your faults. If you ever do decide to send them a letter, you may be surprised to find out that they only hoped for life to continue on for someone. The people who donated their organs were also human beings who contained multitudes. And then we have examining the evidence. So just remember, again, asking ourselves, what are the facts and what do they show? Labeling or mislabeling, labeling and mislabeling. So instead of acknowledging something as a one-time incident, this is where we apply labels to things or judgments to things. And we can do this for ourselves. We may do this to others. So for example, your doctor seemed distracted the first time you met them, maybe like they weren't listening, becomes the doctor is arrogant. So to counter, again, we have the semantic method, right? Looking at the meaning of those words. So consider the words you're using. So arrogant is arguably a strong label. We can use this in conjunction with the next strategy, which is let's define terms. So defining arrogant, that is having or revealing an exaggerated sense of one's own importance or abilities. And then asking ourselves if we could really make this determination based on that interaction with the doctor. So again, we're seeing elements of examining the evidence, of being specific, and again, with be specific, avoid adjectives. So seem distracted, for example, can become the doctor was looking at the computer or clipboard instead of me when I was talking. Was that every time? Was it almost every time? What other possible explanations could there be for that? And personalization, and sometimes this particular cognitive distortion, I've seen personalization, I've seen blame, I've also seen personalization and blame. I think it's defined as or identified as blame in the handout packet. So this is where, again, we conclude without a lot of evidence to support it, that anything negative that happened was either our fault or that it reflected our shortcomings, even when under no circumstances would anybody say that we were responsible for it. So this is where we can confuse influence with control over others. So an example of this would be survivor's guilt. Somebody had to die for me to keep living, or I'm living and there were others I knew who passed away while they were waiting. Self-disclosure, again, is really important. You know, you can write about it if that is something that is helpful to you. So you can write yourself a letter. You can write to your donor. You can write to your past self, to your future self. You can also talk about it with people you trust. You can ask the other person not to immediately jump in, tell us that it's not true. You can just ask them to listen, to show us that empathy. Sometimes we just need the validation that if someone else was in our place, that they would feel how we're feeling. We also have the double standard technique. Again, so think about how you would respond to a friend feeling this way. Aren't you happy your friend is still alive? Again, in this hypothetical scenario, would you think your friend's survivor's guilt is true, full stop? Or would you tell them that it may be true that they're feeling this way, of course, but not quite in the way that they're framing it? So for example, someone did die, and either they, before their passing, or their loved ones, just before or just after their passing, chose to donate their organs for the purpose of someone else to live. If you're feeling the survivor's guilt because of the people you knew who died while waiting for a transplant, think about how you would or did feel when someone you knew received an organ before you, or how you would feel if the positions were reversed. Would you truly, actively, and fully resent someone else for living? And again, I made the same mistake here with the shame attacking exercises as before. I'm not suggesting that you do anything in public here, but again, sometimes saying things out loud to ourselves, to our pets, can be freeing. If you feel guilty and are ashamed of your vulnerability, remember that only the strongest people can admit when they feel vulnerable. And so now we have our mindfulness exercise. So this is the third one. There are 3 mindfulness exercises in the handout packet. I chose this one called HALT because admittedly, when I saw what the H stood for in hungry, I thought of those Snickers commercials. It made me laugh. And hopefully anytime you look at this from now on, you'll think of the Snickers commercials and maybe laugh too. So HALT is, I think, a great example of a mindfulness exercise because it doesn't necessarily, at least for me, fit into what I would conventionally think of as a mindfulness exercise. If I hear the word mindful, I usually think of something like meditation. But this exercise kind of cuts through all of the things that we might say to ourselves, like, oh, well, I don't have time to meditate, or, I can't imagine sitting still for that long, or something to that effect. HALT is essentially just stopping and checking in with ourselves. So first, asking ourselves if the way that we're feeling right now, maybe it has something to do with hunger. So being hungry can affect our minds by, we'll lower our blood sugar, we'll feel more tired, it can depress our mood. And it also prevents our prefrontal cortex, which is right up here at the front. So this is all of our critical thinking skills. It also helps control our impulses. It keeps that part of our brain from running at full capacity. So in a nutshell, when you're hungry, you don't think straight. And then the A stands for angry or anxious. So we'll check in with ourselves, our body signals. Maybe if we notice that we are tensing our shoulders, grinding our teeth, or clenching our jaws, balling our fists. So being angry or anxious, of course, can affect us by releasing cortisol. So that is associated with stress, which is in turn associated with that fight or flight mode, right? So shutting down what it sees as unessential survival systems. So when our bodies are in this state, all activity goes to preserving everything that is in our body cavity. Your hands might become cold, your feet might become cold because the body is redirecting blood flow. And it is very difficult to think straight or to think clearly when the rational parts of the brain, again, so prefrontal cortex, huge part of that, is unable to think and to really reason through things. So we may get an inaccurate perception of what's going on, and our decision-making may not be at its best. Asking ourselves if we're lonely, so thinking about our friends, family, the social connections that are most important. So we might just feel very unhappy, we might feel resentful, we might feel unsupported. And then that can also too just lead to feeling physically unhealthy because of the close relationships between our emotional and physical well-beings. So when we're lonely, we don't really feel at our best either. And then of course, checking in with ourselves to see if we're tired, either mentally or physically. So that can lower our self-control, our willpower. We might make choices that we later look back on and wish we hadn't made. And will essentially just feel kind of just like we're moving through water. We're just not quite as sharp as we would like to be when we are like that. So if you are like me and don't really understand how naps work, if you do understand how naps work and do that, wonderful. But again, if you're like me and are still confused about it, then can simply make it a point to try and unwind a little bit earlier that evening and making sure that you can get as good a night's sleep as you possibly can. So I might have accidentally, there we go. Okay, here we are. So I did link some free mindfulness or positive mental health resources, both some apps that you can get on iOS or Android, as well as some websites. And while I was putting this list together, Insight Timer, which is just one of, this app has come so highly recommended to me from my friends who are particularly in the field of mindfulness, self-care, and well-being. The Insight Timer website also had a post about this particular mindfulness exercise. And so in the PDF of the slides, if I did it correctly, you should just be able to click right on there and it'll take you to the correct web page. And then, my apologies, I'm going in the wrong direction. So that was the very end of our presentation here. Michelle, would you mind activating the poll, please?
Will do.
Thank you. So is there at least one cognitive distortion countering strategy that you want to try? And or do you see yourself applying one of the mindfulness exercises? So that could be the one that we just talked about. It could be one of the other two mindfulness exercises that are in the handout. Okay. It's my first time actually seeing a real-time Zoom poll, and I must say I'm very excited about the technology.
Great. And we can leave it open for a little bit. And if you want, I can start asking a few of the questions.
That would be beautiful. Thank you.
Sure. So I'll just leave that up and just kind of, stay off camera and ask you a few questions. So Jay asked, have you found in your work with kidney transplant patients that their personalities have changed after receiving the new kidney? Have you ever seen PTSD and spouses being critical of the patient?
Thus far in my career, my practice experience has primarily been with folks who are actually in the pre-transplant stage. But when I was doing research for this presentation to specifically look at the challenges that can be specific to folks after a transplantation, I did see a great deal of evidence for PTSD symptoms. Just again, because we were in that chronic state of fight or flight. And when we are in that state for an extended period of time, it can almost become our default in a way. So it's hard to shut off and really easy to turn back on. And as far as being critical, I think that that was one of the things that made me think of when we talked about the should statements. I believe it was like, you should be grateful, and it's like, just because you're expressing perhaps things that you're struggling with, things that aren't great, because it's not like you go through the surgery and all of a sudden every single problem is solved. You're still a person. There are still things that you have to do. I was really, even just in working with one patient in particular who was awaiting a transplant, just beginning to understand the multitude of hoops that he had to jump through, all of the assessments that he had to take when it got to a point where he needed to show evidence of having someone in his life, who would be, helping him following the surgery. And he said, I have no one. And because everybody who had been in his life, he, cut off contact with because they were not healthy for him. And so I think that, it is very easy for anyone who hasn't either been through that process or seen someone go through that process to really discount the number of stressors that are a part of it. And it's a lifelong thing. It really doesn't end. So I think that if anyone is being critical, it might be some time for some compassionate education. But the short answer to your question is PTSD, absolutely. And when others are critical with us, you can show them this presentation if you want.
Thank you. And we have a couple more. We have a limited amount of time, so I'm going to run through them and try and get to all of them. Have you ever had a patient have an anonymous living kidney donor and then later meet the donor and have mixed feelings about their kidney donor?
I have not had that experience, but I think that having those ambivalent feelings, like where we feel things that are contradictory, or even, whether we like that person or, something to that effect, because living donors donate for a lot of reasons. And we may not obviously know those going in, especially if we don't, know who the donor is. But to me, the ambivalence absolutely makes sense in that context. You don't have to feel, and you can be appreciative that this person made this decision. You don't have to like them.
That's fair. And then we have from Kelly, relevant to the HALT exercise. If you think everyone hates you, you probably need sleep. If you think you hate everyone, you probably need to eat. Could you comment on that simplified version?
I love it. I think it's fantastic. Yeah, I think because, and I like too that it brings attention to two very critical physical states like hunger and sleep. And again, I think what I liked the most about that exercise was how it called attention to bodily states. So thank you for that. I appreciate that.
Great. And then Roger says, thank you. And he also says, wondering if many patients are on psych medications. Seems that trauma, worry, etc. are so great. Are there many contraindications?
excellent question. I would probably, as far as the contraindications go, it when it came to the medical literature on this topic, it was very difficult to kind of narrow down, because people are in medicine and also in many other capacities in social science, they're very reluctant to generalize when it comes to people. So there might be an article written about the effectiveness of antidepressants for a particular subset of the population in a specific part of the country, but because of the reluctance to generalize, it can be very difficult, I think, for us sometimes to take what information we need from that. And sometimes, I know, at least for me, I felt more confused than when I started, which is another aspect of the stress of this, right? So I think it would be very, very important, because, of course, there are a lot of medications out there. And I think that too, I've seen a lot in the OBGYN space for people who are pregnant, that the understanding of what is safe to take while pregnant is really broadening. And there were a lot of things I remember hearing, maybe 10, 15 years ago, that all of a sudden it's like, oh no, you can drink coffee, not over a certain amount, but, and I would very much hope / like to believe that the same would be true here. And so I think that while I wish I could answer the question more directly, I believe that psychotropic medication could most definitely be appropriate, and that just a conversation, perhaps. I think releases of information can go a long way. If you have a psychiatrist in one location, and then you're working with a primary care provider or a specialty doctor as far as post-transplant follow-up care in another location, you sign a release and ask them to communicate with one another, just so that they can have a conversation with you about, what next steps might be best. I think that could go a really long way.
Great, thank you. And then lastly, just a comment from Dave, who said, absolutely brilliant work here today, Allison, coupled with some very compelling visual materials. Well done.
Thank you. That's very kind. I appreciate
Very nice
that.
of him. Thank you.
Thank
Then
you.
thank you, Allison. That was great. We really, really appreciate it. And I want to move forward with closing out this year's conference. We want to have one last final message from Marty Marin, who is the co-founder of Trio Maryland.
Thank you for joining us today for Trio Maryland's second virtual transplant conference. We hope it was educational and provided the information you needed to lead a healthy transplant life. I would like to express our gratitude to the Trio Maryland Board of Directors, Ashton Conference Planning Professionals, and also our partners, the Living Legacy Foundation of Maryland, Johns Hopkins Hospital, and the University of Maryland Medical Center. I'd like to thank our speakers for sharing their expertise with us. And a thank you to our sponsors that continue to support Trio Maryland and all of our educational efforts. Trio National, Biloxis, Anatomy Gift Registry, Peak Relief, and the National Kidney Foundation of Maryland and Delaware. Don't forget to check out our sponsors' websites for details and information. All sessions have been recorded and will be available to view on the Trio Maryland YouTube channel. And our email notice will be sent out to you when it is available. Check out our website at www.triomaryland.org to view our calendar for upcoming speakers. Follow us and like us on Facebook and Twitter. I post current information daily, so don't miss out. Check out our YouTube channel for past presentations, and we want to thank you all again, and thanks for starting your day with us.
And I want to thank you. And as Marty said, we invite you to visit the website and join the organization. And of course, if you like what you see, if you want to continue on upcoming events, it is a solely donation-supported organization, and they always welcome donations. So have a great rest of your weekend. Thank you again, Allison, and we hope to see you at future events.